Hey everybody, welcome to another podcast. So we are super excited today because we're kind of talking about things that we have watched create amazing benefit in people's lives, and that is the integration of yoga into medicine. Amy, you want to talk a little bit from the doctor's view on why this is amazing?
Yeah, it's us seeing our dream come to fruition, isn't it?
I know, right?
We had our wellness center 15 years ago, yoga, massage, and then I had my medical practice. And this was always a dream to really be in one space where we integrated yoga into healthcare, really, into people's health and their medical plans. And so it's so neat now that literally every day I come to work in a space where my medical office and our yoga studio, I implemented in everybody's plan, really. And then you meet with people and you get to meet with them one-on-one. And
it is so nice because we've got not only you and I chatting about this from the medical, but we also have Kim Carlson here with us today in this podcast, which is awesome. And to talk about how this works even on a daily basis. So I know you're going to get to that here a little bit later. But looking at this big picture, Amy, your vision for integrating at the highest level holistic care to your patients, why is it that yoga creates this high efficacy, right? This benefit to people in their quality of life?
There are so many medical research studies out there looking at all the medical benefits of yoga, and it really comes down to not just physical, but mental and emotional. Anything from anxiety and depression, overall stress, sleep disorders, arthritis, osteoporosis, high blood pressure, inflammation, heart disease. It's unbelievable if you go out there and look at the medical research, all the data that's out there, and then we get to see it on a day-to-day basis, just the profound transformations. And I watch people, it's so fun every day. We have class offerings that we're going to talk about that every day we have a yoga class, actually Monday through Sunday.
Yay.
And the number of patients that I see coming and going that are our patients that are taking yoga classes and watching the benefit in their health that they have had, and one-on-one working with you as well. So
I think it is kind of interesting because at first we're like, oh my God, this yoga stuff works, right? Because we've done some studies, we'll chat about that here in a minute. But now it's just like, yeah, it just works, right?
Well,
it's like, yes, this is a great model.
Well, I don't know
because your personalized plans, every one of them, because Amy creates the personalized plan, which we know is a big part of the holistic care, right? And then on the coaching side, then I grab that and we start to integrate that. Our breathe, eat, move, sleep, breathe is the yoga stuff. And then to integrate that into people's lives. But it starts with your personalized plan. Give us a little bit more about why that is so important.
Well, 80% of chronic disease is the root caused in our lifestyle. And a lot of that has to do with chronic stress and a lot of the mental and emotional issues that we're dealing with, or lack of sleep, or our nutrition, or our lack of movement, our American lifestyle, basically. And so, I just think that is such a crucial place that has to be in balance so that you can either be preventative and proactive, or you could start healing your body and helping your body work the best way it can. And I was thinking this through when we were talking about, doing this. I don't know that I know of any other physician office or medical practice, and we would love to see this become like truly a model for
That's what we're going to help people
because
do.
our system is more focused on sick care, right? Or it's not a
It's amazing at that,
model.
and let's not discount that. But it's not preventative holistic care. It doesn't allow you to live to be 120.
And everybody, these are tools. So I would say, our patients all have what works best for them. Not every single person does yoga, but I think they do some aspect of this breathe pillar, whether it's 2 minutes of just stillness and mindfulness, or it is physically coming in and doing a yoga class. We have a lot of virtual yoga classes that you share with our patients. So it's profound.
Making it easy and
the
doable.
breathe pillar, it's our foundation, and I think everything else builds upon it. So, yeah.
And I just want to chat a little bit about, because we ended up doing a study, and this was kind of like right during the onset of the pandemic. And it was looking at this coaching model, right? This breathe, eat, move, sleep model. And I think to preface it, there was a Forbes article in 2020 that said the future, to heal this healthcare system, you need a care team, and then you need the personalized plan, and then you also need someone to help to walk with them through the change, right? This is what we're doing today. And so that was Forbes in 2020. I mean, they're saying this is it, right? And so to your point, we're doing it. We're seeing amazing improvements in people's quality of life, and so stay tuned for those. We're going to be doing more of that soon in another podcast. But it is exciting. And we just wanted to highlight a little bit. We did do a study, and it's been a few years, back in, looks like in 18, no, it was 20. And so, some of the things, and this was looking at, we used the RAND instrument, right, this SF36, which a lot of times when you're looking at research studies, that's a big one for NIH. They recognize that as a tool. And our findings were pretty amazing. And this is amidst COVID, number one, when I share this data. And then also that Indiana isn't, it's not the healthiest state. And I'll talk a little bit about that here in a minute. But one of the things, so from a health perspective, Indiana, social and economic, we're ranked 36 out of 100. Seems like Colorado, some of these are always at the top. The physical environment, 46%. Clinical care, 24% and decreasing in Indiana. So we got a big opportunity to take, that's what we rank, and we're getting worse. So we're hoping that what we're doing catches on, and that other providers want to be doing these kinds of models to help the true care of the patients. Behavioral health, 28% and decreasing in the state of Indiana. So, all right. So we got opportunities, and that's fine. We're here to help that. So, looking at some of the analysis, role functioning physical, these are all terms from the RAND SF36 role functioning. 24% in females on that one. Pain, 26% in our male participants, improvement, which is awesome. And general health overall, males saw a 20% improvement. I mean, that's a big deal when you're talking about...
If that was a medication that was getting approved, you never see those improvements in
you just
in
don't
research
see that stuff.
studies.
I know, right?
That is crazy.
And so, looking at this collaborative, holistic view is, again, what Forbes was saying in 2020. And I mean, this is what we are. We're a holistic primary care provider. And you're like, we got to use, it's not direct primary care, you'll hear that sometimes. Concierge medicine, you'll hear that kind of sometimes, because it is membership based is what we do. But it's a holistic primary care, and that's what's on our front out there, because you're like, it's different. This is a preventative, heavy preventative model, high touch. And so we're excited about what that can do for us.
So back to those studies. Basically, that was using our 4 pillars, the breathe, eat, move, sleep.
Correct.
Helping coach people, just to be clear.
Lifestyle.
And on lifestyle. And this was all virtual. And just to see those improvements, and that was in a short amount of time.
Right. And we've heard this over and over again. The change in life has to be fun and doable. I mean, how many times you go to the doctor, you do once a year, and they say, hey, here's all the things. You get this massive plan. And no one's reading it. No one's there to help you to create the change. And we're all so busy that we do need someone to kind of help grab us. You do have to have a will to want to change. That's number one. If you don't do that, then you're just where you're at. But you have to have a will. And then we are super excited, all 3 of us, to be able to share with people how to get that journey going, whether it be in the yoga to reduce the stress, right? And we can get into nutrition, which we do on a daily basis with our patients, moving the body and the importance of that, all the way down to sleep. So I think we were also wanting to kind of maybe shift and talk a little bit about our teacher training, Kim. And so this is at the highest level of our breathe pillar, right? And this ends up being a lot about, we call it the art of yoga, because integrating that into the fabric of who you are, and on the yoga side, it's a body, mind, soul experience. If you're okay with the soul thing, if you don't believe in that, then it's just a body, mind thing. It's fine. But that's what we're trying to do, and that's what we're trying to integrate at that highest level. We've been working together, I think, for maybe 4 years or so.
I think this will be our 4th training together.
I know, it's so exciting. And it's so neat to watch the integration of people. We got this amazing space. This is the yoga space, and Kim's studio is here. This is where you're housed. Roots and Wings, yogawellness.com. And so, I mean, what is it about, this teacher training that we've fallen in love with? Because it is so cool to do. And actually, Amy's here with us too. As a medical doctor, we're probably the only program that I know in the area that has a medical doctor tied right into it from the get-go.
Well, I think yoga as a overall, you talk about your 4 pillars, and while you classify yoga as your breathe, I think the amazing thing with yoga is you hit all 4 in a yoga practice.
Right.
Because yoga is about bringing it all together. So you are learning how to breathe. So many people don't know how to breathe, or they don't realize that they're not breathing in a way that is nurturing to their body and their nervous system. So learning to breathe is obviously an important component, and we get this in our 60-minute class offerings. You get this in your virtual offerings that you offer your patient, the recordings. But when you do a teacher training, you really deep dive into these things, so you can have a sustained practice on your own. You can learn to share this with loved ones. Not everyone that does our training goes out and teaches what you would think a traditional class, which we encourage people, just come. If you have a desire to learn more about yoga, we want to share that with you, and then it'll be a ripple effect that you can't control.
You might be teaching your family.
Sure.
Right, we've watched that over and over again, right? Integrated into your kids, into your spouse, and a lot of times the spouse could take years, but eventually they're like, I don't know, I like what you've got. What is that?
So with your pillars in yoga, we've touched the breathe. Obviously, a lot of people come to yoga for the movement, which is, your move pillar. And that is a big component. We know, we just had this discussion yesterday about how much more accessible and easy if that was to tap into our meditation practice after we had moved. So we have a lot of just repetitive, stagnant body postures, like even just sitting in this chair right now. If you do this more than 20 minutes at a time, you just start to have stagnant energy in the body. You start to gain a little tension and tightness in the body. And if you don't move your body and learn to do so in a way that is safe, that helps with releasing tension and tightness and all of those other things that accumulate in the body, then we know that that's not good for us, right? So the move component is weaved into every yoga practice. So we have, and then eat. I always like to think of eating, we eat more than just food, right? What else are you digesting into your body? What else are you putting in there? What are you feeding it visually? What are you listening to? There's a lot of other ways that we eat and consume information, food, whatever that is for you. And then sleep. I know we haven't
There's no ties to sleep, is there?
I know we haven't quite
Yoga
hit yet about our guided relaxations that we all love and have found to be really impactful on our clients and patients. But that's a component. If you've ever taken a yoga class, lying down and taking that rest before you step into the rest of your day is a little bit of the sleep component, but that's the time that the body rejuvenates. It's the time that the body really integrates all of the practices together. So that's why I think yoga is just a no-brainer to weave it into a medical plan, a lifestyle plan.
Yeah, it is amazing. And we've had so much fun with it, right? And getting people, I know, all 3 of us, to watch, and we just graduated some of the 500 hour, and so to hear them share the impact that has, a profound impact that has had on just their consciousness and how they perceive, life in the world around them. I think helps them at that higher level of consciousness, helps them to just be who they want to be. You know, what is my purpose? How do I serve? Versus being reactive. We're all really good at that in America, right? It's so busy, all we can do is hang on and just react to everything. And that's fine, we're very productive people, but it's not healthy. We know this, right? And it's not sustainable, right? It's like a Jenga game, right? It's just, we keep building it and more stress, and then we go until it collapses. And then we build it, and then we just, this is like, oh my gosh, get away from that mode of how we live and start to live in a way that is sustainable. And I know the yoga does that over and over again. Kim, share with us a little bit about, you have these amazing classes every day right here in this space. What are some of the classes that people could attend?
Well, yes, thank you. We do have daily classes. We have, if you see on a schedule, vinyasa, I think sometimes people are like, ooh, what is that? I don't know. I don't know if I can step into this. All that word means is that you are linking your breath with movement in the body. So there's two of your pillars right there. It sounds easy, right? But you're going to move your body intentionally, and it's a practice so that you can then leave your mat and can you move and breathe intentionally in your life off the mat. So we offer this vinyasa class. That's what that means. All of our teachers, I think, do such an amazing job of meeting students where they're at. And so if you come in and you have a knee issue, a shoulder issue, then we can give you choices on your mat. How can I move and still receive the benefits of yoga, of movement and breathing, and still feel good in our bodies, right? Not everyone's going to look the same on their mat, and we encourage people to just to move in a way that serves them. So that is what vinyasa is. We also offer the yoga nidra classes. Some of them are combined movement with this yoga nidra. Yoga nidra is just simply a relaxation process. It starts to get the mind in a place where it can rest and rejuvenate. And so we love those offerings for, I know your patients.
It's probably the most powerful thing with the coaching that I do. It's the most powerful modality or protocol that I can share with people.
I would say every patient, we've ended up touching upon it. From kids, I use it a lot in kids and teens to adults.
Well, the three of us do it every day, I know. We find some way to, it's just relax. If you don't like yoga nidra, it's just relaxation. It's getting away from dis-ease and into ease, right?
Physical, there's a method to it, which
physical
helps.
relaxation, I know. Physical, mental, emotional relaxation. That's all it is.
Well, and Amy, you mentioned how this can be used with kids or adults, and we have had so much fun seeing families come in here and practice together. And we're getting ready to roll out in July an Intro to Yoga series. It's going to be 4 weeks. We know it's intimidating if you've never stepped into a yoga practice or a yoga studio. You're like, what do I wear? Do I wear my shoes in? Do I
too
not?
Tight to do yoga. I love that one. I'm like, give me a break, then you need it more than me.
And so we're really excited to maybe debunk or some of these things that people already have a mindset of what yoga is. We want you to come in and let us help you just find a practice that serves you. That is one thing I have always said, that if my class isn't the class for you, there is a yoga class for you. So never give up on finding the class that's for you. Yoga is literally for everyone in some shape or form.
How do they find you? How do they sign up for your classes?
So my website is rootsandwingsyogawellness.com. I think you have a link from your OPT2LIV as well.
You can get it at the very top in the header of OPT2LIV.com.
There you go. So you can find our schedule there. You can follow us on Instagram and Facebook too. We post out all those things. We do post out our offerings, and yes, it's just, we're so happy to be in here and have this beautiful space to serve out of.
It's got such good energy in here.
It does.
It's healing. It's actually healing. We hear that all the time.
The other new class that we're offering, I wanted to mention, is an athletic yoga stretch.
I love that we're doing that.
Athletic recovery day stretch. This is gonna, I think we're actually rolling this out next week. So, but we have a lot of patients with children who maybe are athletes. They all, I mean, I have 2 teen athletes, and their coaches are always working on trying to find more mobility in their bodies, having that recovery day, so that they can stretch. And so it's just going to be a really nice overall stretch. And if you're not an athlete, that's okay. Like, you can still come and just get an overall stretch in the body. And so I'm really excited to offer that out.
And I think adults, like I know the instructor that's doing it, like, she's a runner, and she was just talking about that, like, as adults, how it's even more important. Or golf, for your golf game. We've done things and studies. I mean, I know you can attest to all of that. And so really, it's any type of movement, you're right, that we just want to be the most effective, prevent injuries, and have long, strong muscles.
That's right. As a mechanical engineer, power is force times distance. So if you, we need the need is in high school, if you want to be competitive, then it is stretching after your workout, getting in here, starting to create longer muscles. They do a great job, I think, of creating strong muscles. Okay, we're doing the workouts and we're doing the squats and we're doing all this stuff, but then they're not also making it long. The collegiate professional Olympic athletes are doing that, which is what you're offering now, which is this, athletic stretch class. So, I mean, if you're a mom listening to this and you've got a kid that is in athletics and they want to be performing at the highest level of their potential, they need to attend that class for sure.
Yeah, I always tell when I've worked with teams in the past, it's like a bow and arrow, right? And if you have a really tight, strong string, that's awesome, but you can't pull it back very far, right? So it's not, that arrow's not going to project with force and accuracy. But if you can have a lot of mobility, a lot of flexibility, and you can pull that back and release, it's way more power, way more accuracy, and that's how the body works too.
I love it. So we are super excited to be able to share this with you guys, this integration of yoga into medicine. It is changing people's lives, and we're so grateful to be on this journey with each and every one of you. We are wishing you guys a wonderful day. Take care.